This is a podcast about trigger point releases. A trigger point is a hyper-irritable spot in the skeletal muscle associated with palpable nodules in taut bands of muscle fibers. By applying pressure with the thumb, finger, or elbow, the trigger point will become hypoxic and will release and no longer be painful. The patient will feel some discomfort and pain initially when pressure is applied, but should feel better as the trigger point releases. The contraindications for trigger points are acute sprains and strains, skin lesions/diseases, unhealed fractures, arteriosclerosis, embolism, pain of unknown origin, or cancer.
When beginning trigger point release, have the patient lay prone if performing on the upper trapezius, as we will show here. You will begin by warming the body up, first with some light effleurage massage. Then, in order to find the trigger point, rub your thumb or fingers through the skeletal muscle and you will come across a nodule or band. And then apply pressure there, but do not press so hard that it will induce pain. You will press against the area, slowly increasing pressure for up to 60 seconds, then slowly releasing. Rest the muscle for a moment, and then reapply pressure, and you can do this 3 or 4 times per trigger point if necessary.
Next, we have the suboccipital release. This technique is sometimes combined with manual traction to help decrease headaches caused by the tightness of the suboccipital muscles. The contraindications for this are the same as with trigger points. The patient may feel some discomfort or tension at first, but as time passes, they should feel comfortable and relaxed.
To begin suboccipital release, rest both of the forearms on the table in order to support the weight of the head and not tire the arms. Hands should be faced up, palms up, and fingers flexed. You will find the base of the occiput on the patient and go just a little below where you should feel the spinous processes of C2, but musculature may be too tight and dense to do so. You will then start with a soft tissue massage from the upper thoracic area and return to the base of the occiput where you were before. You typically hold this pressure for about 5 to 8 minutes or until the patient's head drops into your palm.
This concludes the podcast on trigger points and suboccipital release.